So the first muscle we have here is the epicranius, and you can see the frontal belly of the epicranius right here. If we turn this guy all the way around, then you can see the occipital belly of the epicranius. You can also see the temporalis muscle, so going right here on the temple, so that is temporalis. Okay, so this big guy right here, this is your masseter. And then you can see deep to that is your buccinator. You also have orbicularis oculi, which is a round muscle surrounding the eye. And then orbicularis oris, same thing, surrounding the mouth. Also, you can see the platysma, which is this big superficial muscle that's covering everything, sort of fanning down the neck. So on this bisected head here, you can see genioglossus, which is this fanning muscle here coming up to the tongue. And then you can see down here geniohyoid right here. So this is your hyoid bone. So this is geniohyoid. Right, so taking a look at some of the neck muscles here, you can see if I turn this over, you can see mylohyoid just peeking out there, right there, and then covering it is your anterior belly of your digastric muscle. So you can turn this around and see, actually, if I take this off, you can see a little bit better. So that was the anterior belly of the digastric. Here's the posterior belly. And then coming off of that is your stylohyoid, going to your styloid process, right there. So this big muscle that I just took off here, this is your sternocleidomastoid. So sternum, right? Clavicle, and then mastoid process, sternocleidomastoid. If I turn this guy around, this big muscle covering all of this is your trapezius. Then you can take it off. You can see splenius capitis here, so coming up here, splenius capitis, and then semispinalis capitis. You can also see your levator scapula, levator scapulae here. And then your scalene. So we have our anterior scalene. This is a nerve, middle scalene here, and posterior scalene right here. Draping across that, we have omohyoid. So two bellies of the omohyoid. You have the superior belly of the omohyoid, and then the inferior belly of the omohyoid. If I take this clavicle off and turn it around, you can see subclavius right there. And then if we turn this guy sort of on his side, you can see a few of the neck muscles. So here we have, coming from the sternum to the thyroid, we have sternothyroid. And then from the thyroid to the hyoid, you can see thyrohyoid right here. So omohyoid is draping across that. Okay, and then coming over to this side of the head, you can see right here from the sternum going all the way up to the hyoid bone, you have sternohyoid right there.